Have you ever really stopped to think about what exactly happens to your internal anatomy during childbirth? Like, how does the human body completely adapt to support, carry, and eventually deliver a baby? Well, today, we're going to unlock the incredible engineering of the female body. By understanding the basics of obstetric anatomy, we can finally make sense of the profound physical transformations that happen during pregnancy and labor. Welcome to this explainer. I am so incredibly excited to guide you through this material today. Now, obstetric anatomy can definitely sound like a daunting medical topic filled with super complex jargon, but don't worry, we're going to break it all down into a really simple, beginner-friendly tour. We'll be exploring exactly how the female pelvis and all its related structures are perfectly designed for their crucial roles. Okay, let's dive right into this. So here is our roadmap for today. First, the bony pelvis foundation. Second, pelvic floor anatomy. Third, the uterus and ligaments. Fourth, pregnancy changes. Fifth, fetal stations. And finally, a quick summary. Let's get started. All right, section 1, the bony pelvis foundation. Think of the bony pelvis as a really rigid, protective basin. It's the foundational frame of the lower trunk that literally carries your upper body weight and transfers it directly to your legs when you walk, stand, or run. Now, you might think the massive hip bone is just one big solid piece on each side. Actually, scratch that. It is really composed of 3 smaller bones that fuse together over time. You've got the broad, wing-like ilium at the top, the curved ischium at the bottom back, and the pubis right at the front. And here is a crazy fact. These hip bones connect to your spine at the back via the sacroiliac joints. Those are actually the strongest joints in the entire human body. They act as vital transition points, handling immense forces every single day. Moving right along, let's talk about the functional passageway this bony basin creates. There's a boundary at the top called the pelvic inlet and one at the bottom called the pelvic outlet. The space right between these two boundaries forms the natural childbirth canal. During labor, the baby has to navigate precisely through the specific anatomical corridor, safely nestled within the protective ring of the pelvic girdle. Now, you might be wondering, is the pelvis the exact same in everyone? No way. To accommodate that childbirth canal we just talked about, the female pelvis has some very distinct differences from the male pelvis. For one, the female pelvis is noticeably broader and a lot shallower. The pelvic inlet is wide and rounded rather than heart-shaped. Crucially, the angle of the pubic arch at the front is much wider, more than 90 degrees, which gives the extra space absolutely necessary to accommodate birth. Okay, moving on up. Section 2, anatomy of the pelvic floor. If the bones are the rigid walls of the basin, the pelvic floor is basically a muscular trampoline at the bottom that holds everything safely inside. Here is where it gets really fascinating. The star player of this muscular trampoline is a group of muscles called the levator ani. Without getting totally bogged down in medical jargon, just think of the levator ani as a dynamic sling. Its primary practical function is to provide unwavering support and stability to your internal organs. It is constantly resisting the downward pressure created whenever you cough, lift something heavy, or honestly, just stand up. Let's zoom in on a major component of this sling, the pubococcygeus muscle. It sweeps all the way back from the pubic bones to attach to the tailbone, or coccyx. Its clinical relevance is massive. This specific muscle plays a huge role in controlling urinary incontinence and keeping those pelvic organs exactly where they belong. And this whole area perfectly illustrates the interconnected nature of the pelvic floor. Take the iliococcygeus muscle, for example. It attaches to a white, fibrous band called the arcus tendineus. You see, this isn't just some random assortment of muscles, it's a highly engineered, interconnected web. The arcus tendineus is actually a condensation of fascia covering another muscle, creating this incredibly strong anchor point that allows the entire pelvic floor to act as one unified supportive hammock. Section 3, the uterus and its ligaments. If the pelvis is the foundation and the muscles are the floor, the uterus is the house where the entire miracle of pregnancy takes place. The uterus is a hollow, heavily muscular organ shaped kind of like an upside-down pear. It sits right in the middle of the pelvis, sandwiched securely between the bladder in front and the rectum in back. It's got 3 main parts. The wide base at the very top is called the fundus. The main central portion is the body. That's where a fertilized egg actually implants. And the narrowed lower portion is the cervix, which acts as the crucial gateway connecting down to the vagina. The functions of the uterus go way beyond just providing a space for a fetus to develop. It is a highly active, incredibly strong muscular organ. So the key takeaway here is this. During childbirth, gravity isn't doing all the work.
The powerful muscle contractions of the uterus are actively pushing the baby down and out of the body, working in perfect harmony as the cervix at the bottom dilates and opens up.
Now, this part is often misunderstood. How does this heavy, muscular house just stay suspended in the middle of the pelvis? Well, it relies on an incredibly complex network of ligaments. You have the broad ligament acting almost like a large sheet on the sides, the round ligament stretching forward, and the uterosacral ligament pulling backward. What's brilliant about this anatomical engineering is that these ligaments anchor the uterus super securely, yet they're still flexible enough to promote and allow crucial fetal movement down through the birth canal when the time finally comes.
All right, Section 4, Pregnancy and Uterus Changes.
So far, we've looked at static anatomy, but human biology is totally dynamic. As the fetus grows, the anterior or front load on the body increases incredibly fast. To compensate for this new weight, your center of gravity actually shifts forward, causing what we call an anterior pelvic tilt. The pelvis literally tips forward. This is the direct clinical reason why so many pregnant individuals experience such intense lower back pain. Their entire skeletal alignment is rapidly adapting to carry the load. And the sheer scale of this growth is absolutely mind-blowing. By week 38 of pregnancy, the uterus has expanded all the way up from the deep pelvic basin right up to the xiphoid process. That's the very bottom tip of your breastbone. The entire abdominal cavity has to be temporarily reorganized to make room for this incredible upward expansion.
What's even more remarkable is how early this upward journey kicks off. By just week 12, so you're still in the first trimester, the growing uterus has already popped up above the rigid boundary of the pubic symphysis and begun to stretch into the abdomen. It's a super rapid timeline of anatomical change that just goes to show the incredible adaptability of obstetric anatomy.
Section 5, Fetal Stations During Birth.
If you've ever watched a medical drama on TV, you might have heard doctors yelling out numbers like -2 or +1 during a delivery. They're talking about fetal stations. Fetal station is simply a measurement of how far the baby has descended into the pelvis. Imagine a horizontal line connecting the two ischial spines of the pelvic bones. In obstetric anatomy, this inner ischial line is basically the zero line. When the lowest part of the baby's head reaches this exact line, the baby is at zero station, which means they are considered fully engaged in the pelvis. From there, it's basically a fascinating countdown. We track the baby's descent in centimeters. If the head is still above those ischial spines, we use negative numbers, -3, -2, -1. Then we hit zero station. As the baby pushes past the spines and continues down the birth canal, we move into the positive numbers, +1, +2, all the way to +5, which means birth is literally imminent. It's a really precise, structured way to track the incredible physical journey of childbirth.
Which brings us to our final stop, Section 6, Summary and Key Takeaways.
We have traveled all the way from the basic skeleton to the delivery room. So here is your quick cheat sheet for obstetric anatomy. 1. The bony pelvis is the rigid, protective frame featuring that uniquely adapted wide female inlet. 2. The pelvic floor, specifically the levator ani muscle group, acts as the dynamic sling holding it all up. 3. The uterus is the expanding, highly muscular house that grows all the way to the ribs and actively pushes the baby out. And 4. The birth process is tracked via fetal stations, a centimeter by centimeter map of the baby's descent.
Wow, we've covered a ton of ground today. When you really step back and look at it, it makes you wonder, if the human body can completely reorganize its own skeletal structure and shift its center of gravity in just 9 months, what other incredible evolutionary adaptations are just hiding in plain sight? I really want to know, which part of obstetric anatomy surprised you the most? Drop a comment below and let me know. And if you enjoyed this explainer today, make sure to subscribe for more simple, structured medical explainers. Keep learning, and I'll see you in the next one.